What is coronavirus? Coronaviruses are a family of viruses that get their name from what they look like under a microscope. They are spherical and their surfaces are covered with crown-like spikes. Coronaviruses are a group of viruses that cause diseases in mammals and birds. In humans, the virus causes respiratory infections which are typically mild, including the common cold, but rarer forms like SARS and MERS can be lethal. Like other coronaviruses, the newly identified China coronavirus is being transmitted from person to person via droplets when an infected person breathes out, coughs or sneezes. Symptoms. Common human coronaviruses, including types 229E, NL63, OC43, and HKU1, usually cause mild to moderate upper respiratory tract illnesses, like the common cold. Most people get infected with these viruses at some point in their lives. These illnesses usually only last for a short amount of time. Symptoms may include runny nose, headache, cough, sore throat, fever, a general feeling of being unwell. Human coronaviruses can sometimes cause lower respiratory tract illnesses, such as pneumonia or bronchitis. This is more common in people with cardiopulmonary disease, people with weakened immune systems, infants, and older adults. Transmission. Human coronaviruses most commonly spread from an infected person to others through the air by coughing and sneezing. Close personal contact, such as touching or shaking hands. Touching an object or surface with the virus on it, then touching your mouth, nose, or eyes before washing your hands. Rarely, fecal contamination. Most people will get infected with one or more of the common human coronaviruses in their lifetime. Young children are most likely to get infected. However, people can have multiple infections in their lifetime. Infection with the newly identified virus has an incubation period of between 1 and 14 days, and there are limited accounts that it may also be spreading before symptoms show. Prevention. How to protect yourself. There are currently no vaccines available to protect you against human coronavirus infection. You may be able to reduce your risk of infection by doing the World Health Organization's standard recommendations for the general public to reduce exposure to and transmission of a range of illnesses, which include hand and respiratory hygiene, and safe food practices. 1. Frequently clean hands by using alcohol-based hand rub or soap and water. 2. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue, throw tissue away immediately and wash hands. 3. Avoid close contact with anyone who has fever and cough. 4. If you have fever, cough and difficulty breathing, seek medical care early and share previous travel history with your healthcare provider. 5. When visiting live markets in areas currently experiencing cases of novel coronavirus, avoid direct unprotected contact with live animals and surfaces in contact with animals. 6. The consumption of raw or undercooked animal products should be avoided. Raw meat, milk, or animal organs should be handled with care to avoid cross-contamination with uncooked foods, as per good food safety practices. How to protect others. If you have cold-like symptoms, you can help protect others by doing the following. 1. Stay home while you are sick. 2. Avoid close contact with others. 3. Cover your mouth and nose with a tissue when you cough or sneeze, then throw the tissue in the trash and wash your hands. 4. Clean and disinfect objects and surfaces. Treatment. There are no specific treatments for illnesses caused by human coronaviruses. Most people with common human coronavirus illness will recover on their own. However, you can do some things to relieve your symptoms. Take pain and fever medications. Caution: do not give aspirin to children, use a room humidifier, or take a hot shower to help ease a sore throat and cough. If you are mildly sick, you should drink plenty of liquids, stay home and rest. If you are concerned about your symptoms, you should see your healthcare provider. That's it for today's video. Thank you for watching. Like and subscribe to our channel for more videos. CTTO sources: cdc.gov, livemint.com, wikipedia.org, and World Health Organization WHO.int. Hello.